Organizers, thank you very much, the organizers and the entire team of Praktani brothers. Very good morning, good afternoon, good evening. The topic which has been chosen because it was given to me about the context regarding laboratory. So the diagnostic laboratories, certain discussion points I have already put forward in the WhatsApp group. So the exact points which we'll discuss it will be very precise, and I will welcome all the questions whichever puts up in your mind whenever you think of a diagnostic lab, going for a test, for doing the test for your own or your own people, your own family members, your friends, your neighbors. Whenever you are thinking of going to a diagnostic lab for diagnostic purpose. So I just want to tell you a small introduction of a diagnostic lab. What is the exact purpose? Why these labs have been in functional? The most important thing is the diagnostic. The name itself tells about the diagnostic. It gives the diagnosis. At the same time, in many cases, we do monitor certain diseased conditions which has gotten established. The disease is established there, like a diabetes. It is established for a particular patient, and he goes or she goes for a follow-up test, and also the monitoring of the treatment which is being undergone for in particular case. So now the point is that the decision points for a good lab and non-good lab. I will not tell a terminology. I will not use as bad lab. No labs are bad lab. So good lab and non-good lab. I have differentiated. So what are the decision points you will go for a good lab? Suppose you land in Kolkata, you do not know about anything about the lab. You just land in the city. What will be your findings? What will be your thought in your mind? That where will I go for a test? So basically, what the patient does, we do receive patients from neighboring countries, also neighboring states. When they come and they decide where will you go, first they go through the shortest way to just go through the browsing in the mobile phone. So basically, most of the places, most of the institutes or wherever the labs are being there, they have a standard protocol. They will write about the test, the certain observations what they have made, and they will put it in the website. Now, where will you go for the test? The most important thing is that now it is already prevailing that labs are doing the test and we get the result, and as a report format we receive that. That is the normal thing. Now if you want to decide where will I go, what are the points you will look for? So all labs are relatively equivalent. Particularly in India, I tell you, around 2 lakhs labs are there in India, and out of that only 4,000 laboratories are accredited. Accreditation means there is a standard which is being maintained at an international level. Certain protocols have been made, and we have got a headquarter for that, and that is controlled by CLSI, which is in Pennsylvania, USA. So they make the standards, and that standard is being incorporated in certain organizations like your ISO, International Organization for Standardization, which is a very common thing. So they have got their protocols from the CLSI, and that is percolated throughout the globe. Whoever wishes to take that and they want to do a good laboratory practice, they will follow that protocol, and the accordingly the outcomes, the desired outcomes will be done. So in that case, only 4,000 labs follow that protocol currently, because in India it is not mandatory. In other European countries, this thing is a very common thing, and that way we decide where to go. So we go for a accredited lab. Now, what is your idea about accreditation? So I have already told the results are being generated as per international protocol. Experts, they have laid down certain rules and regulations for a lab, and the labs will follow that. So based on that, your decision point for a good lab will be, it is accredited or not. There may be certain labs which are not accredited, but they are functioning well. Their products, a lab's product is the report which contains the information with the desired information for what you have sought for. So the important point is you look for the accreditation first. Any doubt in that? So till now, where will you go? First is the accredited lab. But at the same time, I have told you only 4,000 in India, they are accredited. We are in a process. I am also involved in that accreditation board, being a member of the Quality Council of India. It controls, Quality Council of India controls that board, and we have a objective of getting all the labs in the country to get accredited, which is a very difficult task. We have shortage of manpower for that, but even then we are trying our level best and using the technology of remote assessments and like that, we are doing that. But the important thing is, where will you go for that? Which lab will you go for for getting your test done? That is one of the important criteria. Second is that uh, what things you will look for, even if you go to a accredited lab. What are your expectations? What are your expectations from a lab? I will tell from patient's point of view, at the same time from lab's point of view. From patient's point of view, or an individual who will go for a test, he will think that my results should be perfectly fine. See, the basic is that whatever is in your blood, if I look for a blood investigation, for a test which is where the material is blood, there may be various types of materials which we use for testing purpose. We mimic that the entire body's material in a very sample form we collect, and we analyze that for a particular test of interest, like your glucose, creatinine, those tests we analyze in the laboratory. We make the equipment to similar environment like your human body. At a normal temperature, we make it a normal temperature for human body 37 degrees centigrade. So that way we make it maintained in that environment, and we analyze the result and we give the report. So from patient's point of view, expectation is that we will get the report in correct time. At the same time, the accuracy has to be perfect. It should be almost, we are not aware, we do not have any, right now we do not have any device, just we will insert in the blood and we will get the report. There is nothing like that. Even then, whatever is we are doing it outside. So certain variations might be there, but whatever results we are giving it, it should be near to or almost accurate to the exact what is in your body. So that accuracy is a very important factor. So that has to be there. Second point, what we are expecting from patient's point is that if I go next day, the report has to be, the result should be similar. And if we go to another lab, it may be possible that where I am going for the test, it is very far. I may not be able to go. Some sample collection staff or some sample collector will come and take my sample and get the test ready from that lab. It may not be possible. So we can also we can also think for another lab. So now the important point is that even if you go for a different lab, the result should, it is expected that the result should be similar. It should not be variable. So important is that my expectation will be from patient's point, if I do that test from one lab and I go to another city and I do the test, it should be similar. That is an expectation. That means the lab should be able to have repeatability. If I repeat the test next day, then the value should come almost nearby, if not same. From lab's point of view, the expectations are there from patient's side. That means patient should, now the thing is that now when we come to a lab, it is not that just we the only one part is there, that is analytical part, or we are examining the sample. It is not like that. There are 5 stages, 5 steps. Number 1 is that your pre-examination state. Next is pre-examination state, examination state, post-examination, then post-examination. In the pre-examination state, we tell the patient how to prepare for the test. There are certain tests where fasting is mandatory, because nothing new we are putting up while doing the test. Established standardized protocols are there, standardized formats are there, how to go for the test, how we have to step by step, how we do the test. So it is nothing new, but at the same time, the standard protocols which are there, it should be maintained. And patients or the clinicians, they may not be in a position to tell everything to everything. We cannot expect everything the patient will know or the individual will know when they go for a test. Example I am telling you, like your glucose test, a simple glucose test. So this glucose test is a very important marker of your glucose level in the body. That is very important. Now there are certain different mode of testings are there. At what particular time interval you will take the blood sample and will do the test. For fasting part, we need to know that fasting has to be done in 8 to 10 hours of overnight fasting. Whole day we fast and we go for a test in the evening. It is not fasting. Fasting, the standard tells it is 8 to 10 hours overnight fasting and we go for a blood test. So we have to tell the patient or the individual that this is the protocol you have to follow. That comes under pre-examination or pre-analytical phase of a testing mode. So in that we prepare the patient. Like for vitamin B12, it is a very common test nowadays. Vitamin B12, the testing, standardized testing procedures have been made in fasting samples only. In fasting means 8 to 10 hours fasting, we collect the blood and we do the test. Uric acid, another test. So uric acid, glucose, vitamin B12, they are mandated for fasting state. We have to tell that patient. We have to make the patients prepare for that. But for other certain high level test, in the sense hormonal test. So hormonal tests, it is expected that fasting is better, but it is not mandatory. In that case, we go for a random test. Any time of the day, you can go for this blood test. So that comes under pre examination state. Next comes the pre-examination. We prepare the sample. We need to prepare the sample. Yes, I will tell about lipid profile. This lipid profile is a very important test. Lipid profile, the particular, because lipid profile tells about your risk for cardiological events in your heart. What are the different types of cardiological events or risk factors? A small type of risk assessment we do from this lipid profile. This lipid profile has got major 4 components. Number 1 is the total cholesterol. Second is the triglyceride, which is in bracket I can tell the oil part is triglyceride particularly. Third is the HDL, high density lipoprotein. That is a one type of cholesterol, HDL cholesterol. And fourth one is the LDL cholesterol. See, these 4 types of tests are being measured. Actually, they are measured in the equipment. In the testing equipment, we measure individually these 4. And based on that, we derive certain calculations. Certain derived parameters are there, like your HDL cholesterol ratio or total cholesterol or non-HDL cholesterol. Like these different components we give in the report. Ultimately, what we do, what a doctor can find out is that based on that values, they will assess the how much the patient or the individual is at risk. Now, many in European countries, they go for a ASCVD test, atherosclerosis, which is the blood vessels gets narrowed and the passage of blood is shortened, so the supply will be limited to certain organs, vital organs like your brain, heart, like that. So there is some factors called ASCVD, atherosclerotic factor, that is a risk. Like that, diabetes, DM, diabetes mellitus, type 2 risk. Like that, the risks are being calculated based on certain algorithm. So for that reason, lipid profile, what we do, we have a concept that it should be a fasting one. Now the concept has little bit changed. It has been updated now. We do not require fasting lipid profile. No, we do not require that. The individual comes and goes for the test as a random. So we specifically mentioned that it is a non-fasting lipid. Non-fasting lipid assessment gives more information about your current state. At the same time, in certain cases we face, I will give certain examples how we face in the lab. One individual goes for a party the previous night, have very good food. Next day he wants to know, let me see how much is my lipid. Since morning he fasts, he goes for a fasting, then he comes for a lipid test, and there is a variation of huge alteration in the test, otherwise which was normal for him. So now you can understand how the food impacts. So food impacts for certain tests, even then if you are in fasting condition. So that is why whenever we go for a test, you should be prepared. If it is an emergency test, that is a different issue. But in case of normal findings, normal tests, we should always be prepared for a test. That means at least now your one thing I will tell you, in lipid profile, this triglyceride values impact a lot when nicotine is there in the blood. So in case of individual who smoke, they should not limited smoke or no smoke for at least 3 to 4 days. That is what the standard says. Because we have seen those who are smokers and they have a very good food previous night, their triglyceride level is very high. That the doctor gets some misinformation about the test result. That does not mean that test value is wrong. That is a very common thing. So this is very important. Your preparation for the test. So that's why I told you we expect from the patient, for the individual, that he should be properly prepared. For that, guidance has to be there. Whatever guidance is required, it is expected that all labs should go for a counseling type regarding the testing procedure when you are going to, because it is very important. Now, one important thing is that we do this laboratory concern, or the laboratory unit plays a support service for the medical treating doctors who treat the patients directly. So they must be aware of, the patient should be aware that this report, whatever he gives to the doctor for the treatment purpose, should be as accurate as possible. Accurate does not mean that only my testing report will be accurate. His preparation is also dependent on that, how he prepares. And from lab's point of view, once we get the sample, we have to process it properly to be fit for the testing. So I told about the pre-testing, pre-examination stage. Pre-examination is where we prepare the sample. We must prepare the sample properly. It is an from the lab side, it should be done as perfect as possible. And next comes the examination part, where we examine the result. We have a standard system of, when we charge the sample in the equipment, before that we prepare that equipment. Lab should prepare that equipment, that the report which will be giving for next 10 to 12 hours or next 15 hours, it should be stable. The equipment should give proper report, and as much as possible accurate. For that, preparations are there. Certain technical terminologies is there, like your calibration part. The calibration means the equipment should be calibrated properly. Those are the requirements. And then the sample should be proper, the reagent should be proper. All those checks are being done from the lab side. Then comes the result part. We give the result, patient takes the result and goes for that. At the same time, it is expected from the patient point of view, when we get the result. So proper time is a very important thing. Like your glucose or sodium. Sodium is a very important parameter in case of aged patients, or now we are also aging, that is also true. So the electrolyte imbalance is a very common factor. So whenever we are giving this, we are giving sample for a testing, like important parameters like your sodium, potassium, these are very, very important. It should be as fast as possible. Lab should give the report as fast as possible, and it should be released as fast as possible to the end user. The end user should be aware how much is my value. Another important test which is very, very common is the TROP-T test. Troponin is an enzyme, is a cardiac enzyme, which is at a very low concentration present in the blood. Whenever there is a heart attack, this particular enzyme gets released in the blood, and it stays for certain time. And that, the moment we expect certain things like your infarction, myocardial infarction or heart attack is about to come, or certain, these things are very difficult to say when it is going to come. But whenever there is a risk is there, suddenly while talking, suddenly I feel little giddiness, and I those things are particular points. Suddenly certain like your fatigue, I am feeling fatigueness suddenly. So those are the points which we have to see, and then go for a immediate troponin T test. So troponin T and troponin I, two varieties are there. So we go for a troponin test. That is a very important marker, and it is the patient or the individual should expect the result within 30 minutes, because the testing part will not take that much time, and it should be immediately informed to the patient, so that the whatever medical requirement or whatever emergency requirement is there, it should be in place. So important thing is that, while it is expected from your point, from patient's point, that when we will get the result. There are certain parameters which are very, very critical. Like I have some examples I've told. Lipid is not that very critical. But glucose is, again, it is a critical. If a known patient with a diabetes is there, and he suddenly feels giddiness, or he's having certain faint is there. So in that case, we go for the test and result should come immediately. Now, how will you trust the result? Your trust for the result should have certain points. Why you will trust this lab? That is important. One very, very important thing is that when we go for a test, there are multiple equipments are there. Equipment will be multiple, and their productivity or effectivity also differs. That one individual or patient, when comes for the test, he may not be knowing that, but at the same time, he should be aware that if I am going for a thyroid test, I should do the test after having the trust. We should go for the same lab, or where there is the same type of equipment. This is very, very important. When we go for a particular test and a monitoring is there, it is expected that we will go for a same place where we do certain tests, where those who are having hypothyroidism, that means their TSH level is high, they are being compensated with certain medicines. The thyroxine is a common thing, L-troxin is a very common thing. So those who are taking such type of medicines, and they should be aware that my testing should be done at a place where we regularly do. Then the variations will be, we can assess, the doctor can assess if any variation is there. Otherwise, equipment, labs definitely take care while doing the test. And we have got a very important thing. Those certain labs will have that. There is a certain terminology called delta check. Delta check means we see the same patient or same individual coming in previous sessions. They come, what is the trend? What is the trend of the values? So that is very, very important. The lab should be equipped with certain things. Yeah. So that is important. Trust. So trust is a very important. See, trust, faith, belief, all those things are similar words. But once it is trust, that means you trust that lab. What are the factors where you trust? You get a similar result. You get a result that is comparable with your clinician's expectation. That is very, very important. One should be very much in close contact with his or her treating doctor, who trusts the value, because one, from patient's angle, one may not be knowing what is the authenticity of that particular result value which you are putting in the report. In that case, Google is definitely a good source of information where you can go for that. But at the same time, whenever you are going for a information from Google, that information should have a HON code. There is a certain terminology called HON code. That means that report, whatever information is there in the net, it has been approved and authenticated by an expert group. So that at the same time, this trust is not easily, it will not easily come. How will you trust that lab? Whenever any abnormal reports are there, that it is a part of the lab to inform you as early as possible, so that your treatment starts as early as possible. So that lab is definitely carrying you when they get any abnormal report, and they immediately let you know. So that is that, like the way we do. I am not getting, because do accredited labs follow regular calibration? Yes. See, in case of accreditation, now certain points has been raised that regarding accreditation. NABL is an organization who, in India, it is voluntary. in other parts of the world, it is a mandatory that they should go for an accreditation. In USA, that is CAP is their College of American Pathologists. They give an accreditation like that. But certain labs, certain organizations, they give only certification. ISO is a certification. ISO 9000, like that, it is a certification. But accreditation means it is an accredited against a particular test. Certain points has to be there. Lab has to follow certain rules, and that will be frequently inspected and frequently assessed by experts whether they are following or not. Now in India, this enable is the organization under Quality Council of India who conducts as per request from the lab. It is not mandatory that you have to do enable accreditation. Lab goes for accreditation thinking of that how best they can give their services, because that is a standard is there, international standard. We follow that. For equipment, I am telling you how why you will go for enable accredited lab. This enable accredited lab has got a mandate of getting the equipment ready for testing as per protocol. Manufacturer is there. Manufacturer manufactures that equipment, and they lay down certain specification that this time you have to calibrate, at a certain interval you have to calibrate. These enable accredited labs are bound to calibrate. And when we go for inspecting a lab, no certain deficiencies we find, and we give only 1 month time, not more than that. 1 month time is given to them if any deficiency is there, and they have to evidentially they have to show the assessing team that this has been rectified. It is not that certain the labs do not do errors. They do errors, but at the same time, if enable accreditation is there, they will have an external check. So that is the advantage, that external inspectors will come and they will go for the they will look out they will observe certain things, and it is not a just one pen show. The my observation and inspector's observation will go to a board, and in that board everyone will put their points. It's totally unbiased. There is no biasing in that. No internal adjustments are possible. So they will do. So that is why it is very vital for a lab to go for an accreditation, and you should or one should look for that accredited lab. It is very tough in that way. So next point is that how will you go for the authentication of a report? See, result is one point. We do a testing, we find a result value, and we put that result value in a format, in a standard format, and it is prepared to the patient. It is given to the patient as a report. So result is one, report is another thing. So how the authenticity of report? Now for enable accredited labs, it is a mandatory for each and every report there should be a QR code. QR code means that QR code has to be there, and the moment we scan that QR code, the entire report will come to your mobile. So that is very important, and one should see that these things are not there in ordinary labs. In normal labs, they do not do that QR code. QR code means authenticity is there. That is the only proof that the report is authentic. Other point is that certain times people also go and just give that normal water, just normal water they give, and they ask for the urine. Please do me the urine test. Go for the urine test with this sample. That way, individuals are there to check the authenticity of the report, whether we are just like that a lab gives the report and we send that or not. Like that, this is the way certain times people check. But at the same time, there are some certain problems are also there during such type of checks. We do have to confront why they have given. They just want to see the authenticity. But authenticity of a report is that this test has been prepared in a proper lab where you can go and ask for repeatability. That is very important. See, trust is another thing. How a trust is developed. Suppose we get a one individual gets a high value report, they have every right to approach the lab and ask for, see, this is a high value report has been generated from your lab. We have received that high value report. Can you go for a second check? Now, good labs, what they do now, whenever they find or they observe a value which is very high, which is much at least 3 to 5 times higher than the normal, they already go for a second test at lab's cost. That way it is compensated. That we, whenever a lab high value or an abnormal value is generated, suppose a very low hemoglobin is there, labs do check. It is true, they do check for a second time, and if any certain doubts are there, they may ask for a second sample also, fresh sample also. That people in a very senior person in a lab, they talk with the patient or the individual, they agree if genuinely it is required. Otherwise, just like that, if the sample is lost in some other way like that, they can tell and they can ask for that if it is lost. And it is always preferred that to whom the sample is given or who takes your sample, he should be under your vigilance, that the particular person or the sample collector gets deposited that sample to a appropriate place where he is expected. So that is also important. So trust is that, you can imagine how the trust develops in that. Lab should always tell in case of these normal just ordinary labs, not just like they start their functioning of a lab, they will not um, assess those type of things, that they have to report the patient. That is very, very important. Next we come. So regarding authenticity, I have told you QR code is a very, very important, and NABL has mandated usage of QR code for each and every report. Each and every report. Next, I come to the mistakes and error handling in lab reports. This is very, very important. This also contributes to the development of trust, or how you see a lab which is a good lab. And because each and every report has got impact on the patient's health or the individual health, that we are aware of that. It is not like that just for a sake of doing the test one goes for a test. It is for a preventive aspect, that is another angle, but for the diagnostic aspect it is very important, and also for follow-up or monitoring of your medicine intake, your disease status, how it is improving, how it is progressing. Those things are also there. In case of mistakes, errors, nobody is God that 100% perfect result one will give. Perfect result in the sense, certain typographical errors, in certain times, certain errors may be there. It is the responsibility of lab to immediately inform the patient or the individual that certain errors have occurred, while at the end of the day we have found out, say, certain errors have been generated. Instead of one sample, another sample has been measured and it has been reported. It is not uh, easy that way, that errors in the sampling error is very, very important, and 70% contributes for sampling error. In a good lab, it is prevented. How? We use barcoding system is there, and once a barcode is registered, while doing the registration, that barcode is captured in each and every points wherever result is transmitted from the equipment. Before putting in the equipment, we prepare the sample, there the barcode reads, then we go for the equipment, there the barcode reads, and that barcode is tagged. The information whatever we give in the registration time, the same barcode is percolated in each and every point till the result is out, and we match the value whatever. A good lab, what they do now, whenever the result is in the normal, if we see a delta check, if we see his previous values, if it is matched, then it is fine. Otherwise, we go for a clinical validation of the technical report. Whatever we are giving, we are generating from a lab is a technical report, a technical value. I do not directly see the patient and take the blood. It has been collected from various places. Doctors, they refer that patient. We do not have the direct interaction with the patient. But whenever is suspected, we directly communicate, a lab communicates directly with the doctor first. So it is very, very important that the patient should declare, they, whenever they are doing a test, we are going for a test, should declare which doctor, because at certain times, no, the patients, if we declare the result, if we tell the result to patient, no, it gets the patient goes, or the individual goes into panicky state. So much high value. Once I gave one vitamin B12 result, I gave 6,000. The normal is that in normal condition that vitamin B12 goes around 300 or 250 to 800 is the range. It is a big range. But certain times the patients are given injections of vitamin B12, and after that doctors wants to see how much is the value, how much is the improvement in vitamin B12 level. I gave one report 6,000. Then I had to argue with a patient, with that patient, why I gave 6,000, why the patient has not died with 6,000. See, these are the awareness. Patient is not aware that with 6,000 vitamin B12 he is going to die. He is not aware. I had to make understand that this value is high because of certain things. A good lab, they should always go for such type of information, because we are getting the information from your blood, the value of the test of interest, and we have to communicate. Communication is very, very important. That is a very important factor, how a lab communicates with a patient or a doctor. If the test has been referred by a doctor, it is the duty of the lab to communicate first. That is the standard says like that. Communication with the doctors first. You have to do. And it may not be possible for the doctor to remember if he sees more than 100 patients or 50 patients per day. It may not be possible. Then in case what we do, we communicate with the patient's relative. We communicate that this is the high value is there. There's nothing to panic. You please inform your doctor. You go and visit the doctor. That is a very important thing. A lab has to percolate that information. Now, in case of errors or mistakes, first thing is that if any visible mistake is there, you should immediately report to the same lab. This is very important. Mistakes, if it is there, one should not go, but it is very common that patient immediately goes to another lab. Mistake means high value is there. Mistakes are there, so immediately you have to go to same lab where the mistake has happened, if it is visible. If any doubt is there, see, very, very important is that this value, whatever labs give, it is going to impact in your disease process if it is there, or in your health system. Health is comfortable is health. Disease is in pathological condition, non-health. So in that case, you just see how important is the value of a report. So that has to be correct in all form. If any visible error is there, immediately go to the lab, ask for that. And important, always it is important to go for the laboratory director who directs the lab. First approach, and he is bound to, in case of an enable accredited lab, there are 26 responsibilities of a lab director. 26 responsibilities are there, and he should or she should obey that responsibility. In case of error, you should immediately go for a root cause analysis. We do have a system of that. And whenever a single error is there, everybody, whoever in the ecosystem of lab, is aware of that error. And as fast as possible, we try to rectify that error. In my case, in my lab, what we do receive queries as complaints. There are majority of the complaints, whatever mistakes, what the patients think, they think that I have given a high value. That means mistake is there. It is not like that. They inquire. Please, I receive calls like that. Sir, this is a very high value you have given. 850 glucose you have given. Can you please check once whether it is correct or not? If sample is proper, if sample, because sample error is not possible. If it is barcoded, sample error is not possible. And one very important thing I just remember now, whenever sample is collected from you, protocol says, standard says that it should be blank. The vial where it is collected should be blank. He should collect it and immediately he should write the name, your, at least, because it may not be pre-barcoded. Samples may not, the vials may not be pre-barcoded. Barcoding means they will come, if it is collected from home, they will come with the sample. They will mark certain information like your name, age, and date of collection. Certain things they will mark, and they will come to the registration desk, and then it will be registered. And after that, the barcodes are generated. If it is not there, then you have to see one thing, that when it is collection is done, the collector should write the name after it is collected, not before. It should not be pre, it has to be post. That is very, very important. Then there is no possibility of any error. So this is the responsibility of the, I can tell in this forum, that is a very important responsibility, that you should always check the name should be later. If it is not there, you can directly communicate to me on the spot. May it be whichever lab in the country or anywhere. It is not allowed actually. Name should be, because a single error generated in the pre-analytical system or the pre-examination can create havoc with abnormal values. So that creates tension, worries, and everything, all possible problems that particular individual will face if errors are generated. Errors are dangerous in lab. It cannot be accepted and it cannot be compromised in under any condition. So that is an important. So from mistake point of view, I told that it should be, if it is visible error is there, visible any abnormal, visible error is there, immediately contact. Abnormal value, immediately contact the lab. It is important. And lab is answerable. Lab is bound to answer your query. Any queries are there. That is how a trust is developed. See, this is very important. If an error said, I must admit error is there, please cooperate, we will definitely look into it. But error settlement has to be as early as possible. It should not give tension to the patient or individual. Now important thing is the sixth point I will tell you. The patients or individuals' rights on labs. What are the rights? I told you the right is that the moment you go for a test, it is expected that you can ask the at the registration desk that who are going to check the result values, who are going to check the patient has got right, and the reception desk is bound to tell you, these are my doctor's panel, these are the panel of laboratory experts, they will review your results before release to you. That is important. Second is that in case of abnormal reports, and in case of abnormal reports, you should be informed immediately. That undertaking you should take from the lab. Please, good lab will definitely report, but even then it is advisable that you ask for that. You have got the right, actually you have got the right to ask whenever any abnormal reports or results are there. Is it possible to inform us immediately? Yes, it is there. But at the same time, certain times I told you that panics may create unnecessary problems. So it is always better we communicate the values through a medical person. So I will talk with a medical person, he will understand. If he remembers properly, then it will be communicated to you. Many of the times the doctors tell that please ask the patient to contact me as early as possible. In my one of my incident, it happened, I gave a result value of 1070 pp glucose, postprandial glucose. And at the same time, one thing I will tell you, there is this glucose fasting and pp. Fasting means 8 to 10 hours fasting, give the blood, have your breakfast, and then make a gap of 4 hours. That is a standard. Average standard is 4 hours, 3.5 to 4 hours gap. At 12 noon, you take the meal, your standard meal you take. Then immediately at the start of the meal, your time is calculated as 2 hours. Fasting and PP is 2 hours at the start of the food. From the start, when you start the intake of food, calculate, and that way you give the blood at the end of 2 hours. That is a standard thing. So these things, I can give certain hints and normal in a piece of paper, and like that I can transfer it how the things are there. So that way it comes under the rights of the patient to ask. Abnormal report has to be informed to me. That is two. Third is that you have got the right in any point of time in the entire laboratory activity, wherever any doubt is there, you can directly go to the lab and ask for your authenticity of the report. You can ask, even if we have got a system of handling certain inquiries. After testing is done, inquiries are there. We transfer that inquiry into particular points. In specific points, we put that and we get the result. And we immediately percolate that information to the patient. We revert that your report is fine. So like that, it is a responsibility. Another important, patient has got rights, definitely, but at the same time, certain responsibilities also there from patient's point of view or the individuals. One should not tell any lie. Lie in the sense, fasting time is 8 to 10 hours and he has fasted more than 14 hours, then coming for a blood test. That is one type of is not expected from patients or individuals, that because the lab carries out the test based on the trust that you have given me the sample, and against them a money will be has been collected, and we give a proper and accurate result at proper time. Our motto is correct time, correct result, no delay, no wrong. So that this comes under patient's individual right on labs. So almost I have covered my topic, whichever I have expected, and in subsequent sessions I can have a uh, pinpoint queries where you can raise. So any questions? I have received certain questions from here. I do not know how much how much I was able to help in that way, but how much I was able to help in that way, but no other queries are there. I think the maximum things I have covered. Any other questions?
Yes.
Bhaskar,
Hello, go ahead.
Bhaskar, this is Showman. Have one question.
Yes, Dada, please tell.
First of all, thank you very much. Wonderful session, very informative session, and thank you for holding this session. You should do this more frequently. I think it will be very beneficial to everybody. I have one question.
Yes, sir.
In many European countries, for blood sugar testing, PP is not done, or PP is not considered as something which is like required or mandatory. But
yes, you're right. You're right.
In India, there is a lot of stress on PP. Why is this difference?
I will tell you. As per the latest mandate from WHO, PP is not at all required. PP is not at all required. It initially it was there. The fasting, first time when a patient or individual comes to assess his blood glucose, to check whether he is diabetic or not, there is a cutoff is there, optimum value is there. After that we tell it is a diabetic. Now for PP, no, the standard is that you have to take glucose, a particular amount of glucose has to be there, he has to ingest that, then after that we take the sample. That is called post glucose load plasma glucose test, PPLPG, not PP. PP gives you the information. Now in our country, this PP, many the clinicians, those who are not that very updated, I should not tell like that, they are all are updated. Those who are not updated, they think that fasting will give you the result of previous night's intake of medicine. because certain time is there and the medicine will act and will bring down your glucose level. So that way the fasting will give the information of that. And what some medicines, majority of the cases medicines are taken before breakfast, so that will give you the impact of that medicine after your pp, after your lunch. So in that case many think that pp is important, otherwise pp has got no textbook, no standard guidebooks. pp related information is there because pp has got a lot of variation. 60 to 65% of variation has been scripted in literature, in journals it is scripted. That pp will give you, it will give you misinformation in that way. But doctors, they do the conventional method, they think that fasting and pp will do the result. But otherwise fasting value and hba1c, there is a certain things which I must tell Somenda is a very strong supporter, and he gets his regular checkups done. All prior programmed are there. We make a specific entire, because he is very much aware of his health. I am particularly telling about Somenda, and he's very much aware. He wants the results to be done in the very perfect way. He put the queries, he asks questions. Very nice it is, and that way. So, Dada, I am able to answer your question.
Yes. One more small question.
Yes,
in the
Dada.
morning, when you go for blood test in fasting,
Yes.
should you take your diabetes medicine and then go, or
Yes,
should
yes,
you not
yeah.
take the medicine?
No, it is not. That becomes that. That is to a certain extent your doctor should tell. Otherwise, from our side, it is not. From lab side, whatever regular way you take the medicine and give the blood, then you take, because you are in fasting state. No, otherwise.
Okay, all right.
Yes, you take the medicine immediately after giving the blood. What is the problem? Because at 8, you should not exceed your time more than 10 hours. That is because your result is very, very important for monitoring your medicine and you're monitoring your disease condition. Isn't it, Dada?
Thank you very much.
Hi, good morning, Dr. Bhaskar.
Yes, sir.
I am Group Captain Bastia, 1982 batch.
Okay.
Just one query, if it appropriate. Is
Yes.
type 2 diabetes is reversible?
No.
Yes.
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 See, I am monitoring my HbA1c level since 2013 for last 10 years. And
Yes.
it was an increase, 5.2 to it reached 8.1.
Okay. Okay.
And without taking medicines, I followed one lifestyle
modification. Yes. Yes.
changes. So now it is 5.9. So whether I am worried whether it will sustain.
You see, definitely, because there are lots of experiments are going on how you improve your insulin level through yoga, meditation, all these lifestyle modifications. I do agree that even in case of thyroid also it is reversed. In case of thyroid also, in hypothyroid case, it is reversed. They do not take medicine. They are maintaining a good healthy lifestyle. That is very, very important. And ultimately, no, with my limited knowledge, what I found from the literature and in various journals, because see, how you handle your body system, that is very, very important. How you handle your own body system. The way you have told, you have reduced the diabetic, the marker, HbA1c is the only marker where you can predict that you are about to have diabetes or you are diabetic or you are non-diabetic. So that is the only test. And I am happy to tell you that I represent the entire country. There are 28 countries who participate in this standardization program of HbA1c. I have participated since 2011. And every year updates are there. We do discuss with 28 country representatives are there. We do discuss, and it has got an impact. We have seen, and whatever our findings, we put it in the WHO, and it is being accepted in that way. It impacts healthy lifestyle and you take care of your pancreas. You cannot directly take care of your pancreas just like that. You have to be very much methodical with your food intake and your regular exercise, because HbA1c means glucose is attached with the hemoglobin, and that attachment has got a limit, has got a level. If it is more, attachment is not possible, detachment, these are not possible in that way, and it is not easily it will be detached until unless either through medication or through your lifestyle. The strain as a good healthy lifestyle impacts a lot in reversing definitely diabetes. I will tell, I have seen in case of hypothyroid also.
Like what I found out, this that the lifestyle in terms of diet and the exercise.
Very important. Yes.
Diet is what I found out is not. It is the portion and the sequencing of diet.
Very important.
That's
Very
what
important.
helped me. And
Yes.
also the exercise part. We generally ignore the like yoga and meditations. But I found out through this program, lifestyle changes programs, that yoga and all those like meditation part of things are equally important, which which strengthen the things like internally, like physical exercise, like playing football, running, and jogging, and gymnastic, and all the things are one part.
Yes.
Like equally, second part is the yoga and other things.
Yes. Important thing for diabetes is the stress. That is impacting a lot. Stress.
Yeah.
How you de-stress yourself, that is very important. In this current era, and with lots of waves around you, I do not know how it impacts, how the waves are impacting. I am not aware. At least we have to be in de-stressed condition. Whatever may be the current position, whatever our responsibilities are there, we have to have a de-stressed condition. Stress is an important factor which contributes a lot in that way.
What is the normal for HbA1c in India? I mean, since you are in the panel, you would.
Yeah, there are three. HbA1c up to 5.7, up to 5% is the cutoff for non-diabetic or low risk. You can say low risk.
5.7.
Up to 5.7. From 5.7 to 6.4 is the range where you might develop diabetes. That is a pre-diabetic condition. After 6.5, up to 6.449, you can say. After 6.5, it is established. One is diabetic. 6.5. But at the same time, if one takes vitamin E in a very high value, vitamin C very high, there are many I do not know alternative. In mobile it comes, in internet it comes, you rapidly reduce the, I do not know how they do, but we have seen certain conditions that 6.5, more than 6.5, and they take certain medicines that they may not be aware, but it has got an impact. Those medicines can impact. Otherwise, this 6.5 is the cutoff for non-diabetic patients. So it is the only parameter where we can get a clue that we are in this middle stage, that we may develop diabetes, and if we behave properly with our body system, I am telling you in a very rough way, behavior with our own body is the result of any problems, how we behave with our own body. So the moment we are alert, we are aware that we have to get rid of this diabetic, and in that way we have to change our mode that how we do. That is the only parameter where we get a clue.
I have one quick follow-up question on LDL.
Yes, sir.
The tendency, at least here, is that whenever your LDL is high, you are prescribed statin. Now, I understand that all LDL is not bad. So,
No, LDL.
One should go for lipid electrophoresis, or the centrifuge, but that is never done here. How do you?
There are some alternate thing. What we do, we measure the total cholesterol and HDL. That means non-HDL cholesterol is the contributing factor for which has been observed to be putting the heart into risk. Non-HDL. So non-HDL cutoff is very, very important. It should be less than 130. That means difference of total cholesterol and HDL. It should not exceed 130. That means non-HDL. Many labs, they do not give this non-HDL. Non-HDL is a calculated thing from total cholesterol minus HDL. HDL is a good cholesterol because it contains certain proteins which inhibit the deposition of the, there is a chemical equation is there where the deposits of this cholesterol, that the bad part around the blood vessel, it will be inhibited in that way. So HDL, high density lipoprotein, that component of cholesterol is very important. It should be always in high. So these statins, what they do, they lower the total cholesterol. In that way, they lower the LDL, and correspondingly they make the HDL high. That way it gives a proper thing. But I have got certain, from my side, my opinion, I have got certain reservation of using these statins. No, I have discussed with many independent internal medicine experts and the medicine experts who are in a bit conservative in using these statins. Statins, I tell you, yeah.
My question is very specific. What I'm asking is, I understand that LDL is also back calculated from
no. Many labs, they do back calculation. They do. There is a direct measurement and back calculation. Back calculation has got a limit. If your triglyceride is more than 400, back calculation is invalid. That is standard. And one should not do that back calculation. Even then, if it is more than 400, even then it is less than 400, this triglyceride, no, it does not always it is not mathematically true. It is not clinically also valid that your LDL should be always, it should be always measured. My bottom line is that it should be measured, not calculated. Calculated result gives a different value.
But it is not done, isn't it?
It is done. It is mandatory for any lab. It is mandatory.
Direct LDL assay.
Yes, direct LDL assay.
Okay.
Yes.
And what about the electrophoresis? Is it possible to get it?
Electrophoresis is there, but if you are getting the information of this LDL, non-LDL in that way, electrophoresis right now in our country, it is a costly affair, and the accuracy has to be more precise. It is not routinely done. Electrophoresis of this lipoprotein, you mean to say lipoprotein electrophoresis?
Yes.
Yes, that is not, it is not done as a routine process. And now within next 3 months, we will, in our lab, we will be doing for academic and research interest. This LDL. Yes.
How do I then get to know the quantity of small dense LDL?
Yes, it is not possible directly. No, it is not possible. Okay. Without lipoprotein analysis or the lipoprotein electrophoresis, it is not possible to know about the small density lipoprotein. Yes.
Okay. Thank you very much.
Yeah, but at the same time, there is one lipoprotein little a, which also contributes to heart failure. In a experimental term, it is there, and we do measure that. Lipoprotein little a is an independent lipoprotein. We do measure that. It is possible. But what you are telling, small density lipoprotein, it is not possible to measure in a normal routine case.
Thank you. Thank you very much.
So someone has asked, Dada, these days, lots of labs send technician for home collection. What is the process to ensure the lab sample collected is safely carried to the lab? Some tests are not done in the city where it is collected, may be sent to Mumbai. Very, very important. I will tell you, the lab should use the only thing which impacts the transport of sample is the temperature. That is the only thing which impacts. So good lab, they use data logger. Data logger, you know, that we can, like we use data logger. We give the data logger that one small device like this small device like this, and I can show you the device. It is there in the bag. No, it is not there right now. But otherwise, data logger is a thing, and they should have the data logger. You can ask the sample collector, do you have data logger? How you ensure that the temperature is maintained? And it is important that one should also check the container where it is transported. Patient has got, the individual has got right to ask for that. If it is not there, you can immediately, you should contact the labs, the office of the lab, or the lab director directly, that how to ensure that the things are okay or not. Understand, sir? Yeah, someone has asked, Gaurav Priyadarshan has asked, challenges in setting up a diagnostic lab regarding licensing, logistics you faced. No, I have not faced any problem while carrying out the licensing. And logistic is a standard logistic. Those sample carriers are there. They have got a stamped thing. They do transport the samples in a very proper way. It is there. Good labs, they pay for that. Transportation is a external process. Certain from distance, they, whenever samples are collected from distance, it is being collected as per the protocol which the state laws provide. Yes, Vikas ji.
Dada, I have one question.
Yes,
If a lab is telling that they are NABL accredited, does that mean that all the tests and the scans done in that lab are accredited, or it may be that some particular type of tests are only accredited?
accreditation means one particular test. Entire lab, if they go for accreditation, that is not. We, whatever we are doing in my lab, whatever we are doing, all are accredited. But it is not the same for all others. It is not.
So does
The
that mean that
accreditation means only in for the particular test accreditation is there, not for the entire entire department. No, yeah. Oh, good. You see, this is the data logger. This is the device. This is the data logger. No? This one we give to the sample collectors. And this equipment, this small device has got a specialty. It cannot be switched off. That is how they have devised. They cannot be switched off. We just put it, and in the box they will keep it. I will keep in the box. The next day when he comes, and I will take this. I will just put in my system. I will check when he has collected the sample. That is tagged in the mobile. We have got a app. We have got an app where whenever the collection is there, the moment it is collected, it is tagged here, and we get directly the information that the time of collection is correct, and we put it, and we see during after collection what was the temperature for that particular bag. Okay, so that is how we authenticate the correctness. You have every right to ask the collector how will you ensure that, because in our country, I do not know about other places in the world, but at least in India nobody asked. It is to be asked. Actually, the trust will be developed in that. One of the component is that.
so Dada, suppose I'm going for a test, so I should
Yes.
ask whether that particular test is NABL accredited or not.
Every right you have got, and at the same time, you can also check the website. We have got an enable website where you can directly see that particular test is accredited or not for that particular lab. You can see the list is there. It is displayed. It is made in public.
So Dada, the same is for ISO also. ISO, like
No.
the ISO
No.
certification is.
ISO. See, enable accreditation is one of the part of the ISO. We maintain a ISO 15189. 15189. We maintain that ISO program. See, this is the certification of ISO. You see, ISO 15189 2022. Can you see that?
Yeah, Dada.
Yes. So ISO enable the labs follow ISO program, but particular 15189, which means the medical laboratory, the requirements for quality and competence. That is important. Quality and competence is important. So ISO 9000 means a generalized. That is more documentation part. And here this 15189 undertakes the entire technical part. Understand? You can check the immediately with your internet. You can see enabl-india.org. enabl-india.org. You can directly look for a particular lab and what test that lab is authorized to after accreditation with that symbol. We use that enabl symbol. So that is authenticated. And more important is what I told about the QR code. You please look for the QR code of that particular lab report. The moment you put that scanner in your from your mobile, that the entire report should come.
Okay, Dada.
So thank you very much. Any questions?
Dada, Vijay has asked one question. What about the reasons? Do they play a role in accuracy of results? Is there any standard?
Where? Let me check once. Let me see the question. Which one?
The second last message, Dada, before Ritesh da.
What about the reagents? Yeah, I told you that before we put the sample, patient sample in the equipment where the testing is to be done. Before that, it is mandatory that we check the equipment. First, we check the equipment. Next, we check the reagent, whether reagent is perfect or not. Just by externally looking that expiry date is okay, does not mean that the content of the reagent will be okay. For that reason, we do an internal quality check. Each and every sample we process, before that, we have to have this internal quality check to be done. And it has to pass only certain instrument. If quality control is not passed, they will not allow patient sample to run. Understand? It has to pass. And at the same time, it is the responsibility of the authorized signatories. It is the responsibility of authorized signatories to check the validity of the reagent, the validity of the equipment, whether it is fit for the test for the next 15 hours or 20 hours or not. That checking has to be done. It is the responsibility. So before that, we cannot. We have got a certain rule is there. Suppose it is not coming perfect, we do have a standardized procedure, operating procedure is there where we check that thing.
Bhaskar,
Yes, sir.
is there any way as an user I can check or I can ask for the reagent details?
100% you can ask. 100%. See, one thing is important. The moment up to what step you have got full right and full authority to ask anything about your sample. Your sample is your sample. It is not my sample. You have given a small amount, a certain amount of money or fees for so that your blood is getting tested. And I am bound to give the result, but a result has to be given with an information then what is your normal thing. If a lab gives a report just like that, only the result, not giving you the reference interval, you should have the inquiry. You should inquire that. So it is important. You have got that right, every right. And
because generally they don't tell anything about the reagent part because the person who comes to the home, he is not qualified enough to talk on the reagent part of the things.
No, it may not be possible in that way. Then, but they do have the communication with the laboratory head. It is every responsibility of the laboratory head to make you aware that your test is being done in this appropriate way. See, in case of certain test results like your those shortcut tests like your the hepatitis test or HIV test where you get the test done in a very shortcut way. It is right, it is perfect. If we procure the materials, the good materials, if we procure, they will give the good results. There, the lab should always write about the details of the samples. the details of the material used for testing such. We do, and we give the lot number, we give the name of the reagent, we also give the expiry date of the item. Many they do not do, but it is important.
Okay, thank you.
Any other
Thank you,
question?
Bhaskar. Both badhiya, very, very nice and detailed presentation, and very good for a layman to understand.
Thank you so much.
Pleasure meeting you after, I mean, even though virtually meeting you after such a long time.
I am always there. You can. I am sorry. In my last proposed this program, I could not do it because of certain technical fault. I was that day in Durgapur to inspect a lab, and they have placed me in a certain place where the internet connection was not there, and it was horrible. It was. So in that case, it will be very. See, somebody has asked me one question. Nice question. Dada, take on online testing companies, and this should be able. I should say this. Yes. Yes. This question raised by Gaurav Priyadarshan at 6:26 p.m. I will tell better avoid, because such I will not name them. They have come to us. They do the testing outsource. They have certain companies. They have made one institute type. They do not do any test. They get test done wherever there is. They give this testing rate is very less. They get the test done there, and the responsibility is very less. If some small lab comes to me and tell that please do it at my cost, very less price you do, I will do maintaining the quality, but everyone may not. Everyone may not, because it is low price. No, I can do XYZ methods to give the result, but most of the time they will not give abnormal results. I tell you, they will not give abnormal results, because the moment one gives an abnormal result, no, they have to face the query. Correct? No, that time the problem happens. So everybody wants normal result. It is no very good for the patient or individual, very good for the doctor, and very good for the lab, but that is not expected. He has paid money. No, the patient has paid money to know his report. One cannot play like that. One lab at hospital refused to give back biopsy sample. No, they cannot. They have to give the biopsy. The sample has to be returned, because sample is yours. Your sample is your sample. It is not mine. You have given to me to get the test done. Even if it is blood, because blood is not staying for a long time. See, a good lab, no, they will keep the sample for 48 hours as per the mandate. For blood test where the cells are there, no, but for urine, we cannot keep. Urine sample after 2 hours, validity gone. For blood, wherever we are doing the cell counts, hemoglobin, your RBC, WBC, the validity is 24 hours. For blood parameters, like most of the blood parameters like your glucose, urea, creatine, validity is maximum 48 hours. If you demand, the lab should give that, because in between, no, you can ask for another test. I will not collect sample from you another time. Next day I will not collect. I will just tell you, give me the name, pay the fees, I will give you the result. So that way, so it is standard is there. I cannot keep more than 48 hours. Each and every state in India, entire sample which has been used, we have to properly dispose. The proper protocol is there that disposing. Any errors are there, no, heavy fine is there for that reason. So every 48 hours, samples are collected and taken away for proper, after being segregated properly, they will dispose that sample. So that is the protocol is there.
Thank you, Bhaskar, for this amazing session. Dada, should we wrap up?
Yes. Yes.
Okay.
So thank you so much. I do not know how much I was able to make certain things, but definitely those who have attended has taken some information which they have not heard. Maybe I do not know.
Definitely, Dada. Very, very informative and understandable for laymen.
Thank you, Dada, for this amazing session. I, on
Thank you.
behalf of the Praktani Executive Committee, want to thank you for all the hard work and the time you have given to all the brothers to inform them about this important aspect of the life, which we all deal in like our daily lives. Because every day, whether our relatives or we ourselves are like in need of diagnostic tests, and knowing all these intricacies and from someone who is giving insider view definitely gives us trust what we should do and what action we should take when we go for these diagnostic tests. So thank you, Dada, for this amazing session. I also like to thank all the brothers who have joined us in this session today. I
No,
believe these
no,
1.5.
before you and I will just add some information about Bhaskar Da. His
Yeah,
younger
Dada,
brother
sure.
was our batchmate, 90 batch, and his father also studied in Vidyapit. So those who may not, who are not aware, just information about Bhaskar Da.
So thank you. But if you this topic is a vast topic, it is true. But if you accumulate certain queries and you put a topic like that, I will take out my time. Don't worry. And for this, no, as I love my subject, I love my work, so I do not have to prepare very nicely what I have to speak. Whatever I am speaking, whatever I am talking, it is from my heart only. Whatever I am practicing, I am talking that only. So be confident in that, and I would be happy to have questions anytime you put in my mobile. That's enough. I will definitely, for all Vidyapit brothers. Okay. So
Thank you, Dada,
nice.
for that privilege.
Yes. Anytime, any type of queries, put a question, no problem. Thank you. Thank you very much.
Thank you, Dada. Thank you,
Thank you.
everyone.
Thank you. Thank you.
Now it is the right time to wrap up.
Yes.
We will see you again in the next Adda. Thank you, everyone.
Thank you. Thank you so much. Thank you.